living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
America is facing an opioid epidemic as more than 100 people die from an opioid overdose every day. That number would likely be higher if it wasn't for a life-saving drug that can reverse the effects of an opioid overdose. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Beth Brown, your host. Today we continue our discussion about opioids by learning how one drug is reducing overdose deaths and how to get help for opioid addiction. Stay tuned. Welcome back to Healthy Living for Life. Last week we talked why opioids are addictive and the part you can play in keeping them out of the wrong hands. This week we look at other aspects of opioid addiction and helping people who are at risk or who are in need of treatment. We start this morning with Lisa Sather, Director of Pharmacy Services for Mountain Pacific Quality Health. Thanks for being here, Lisa.
Thank you, Beth.
So what is naloxone and what does it do?
Yes, great question. So naloxone, also known as Narcan, is an opioid antagonist. That means it works, you know what antagonist means, it works against something, so works to counteract the potential life-threatening respiratory depression that can occur when somebody has an accidental opioid overdose. It basically helps to knock the opioid off the receptor, and it helps to restore someone's breathing and gets them back to breathing normally again for a short period of time.
Is it new, or how long has naloxone been around?
Yeah, so I actually didn't know the answer to that, and so recently I looked that up, and it actually is not new. It was patented in 1961 and was approved to treat opioid overdose in 1971. But it's really intriguing because we are obviously seeing an increase in utilization and availability of this life-saving medication in the midst of the opioid overdose epidemic that we've been faced with this last several years, last decade.
So you talked about this a little bit already, but so how does naloxone actually work to antagonize that opioid overdose?
Yes, that's a great question. So, chemically speaking, opioids bind to opioid receptors in the brain. We've talked about that on a previous show. And what happens in an overdose situation is you have too many opioid receptors being occupied, and that obviously can cause what we talked about, which is decrease in respiratory rate, decrease in heart rate, all those kinds of things that go along with it. What naloxone does when it's administered, now again, it has to be used when somebody has an opioid in their system, but it goes in and it basically likes those receptors more than the opioid itself. So it's able to knock the opioid off those receptor sites so that basically the big side effect we're talking about, which is respiratory depression, somebody can then start breathing again on their own and then get emergency treatment right away. It's important to mention it's temporary, so but it has a higher affinity, we call it, for those opioid receptors than the opioid does itself.
Okay. And so obviously if someone is overdosing, that is a serious situation.
Absolutely.
And it's not something they can give themselves. So
Right.
How does someone get naloxone? How is it administered?
Right, so it's really kind of cool because naloxone is available in a nasal spray formulation. So that's pretty easy for someone else, like you or I, to give to someone who has a suspected overdose. It's also available to be given in a muscle, so intramuscularly, or by trained medical professionals in an IV format. They can draw it up in a syringe and give it directly into a vein. The nasal route's pretty cool because it works pretty rapidly because your body doesn't have to go through some of the absorption characteristics it would normally have to do. Normally, in the past, the administration, when it was available IV, was really limited to your healthcare professionals, but with the nasal formulation and even the intramuscular injections, that can be administered by a layperson. And so, it's really important if you have a family member or a friend that potentially is at risk for having an overdose situation, that they learn how to use it.
So if a person is on a high dose of an opioid, should they have naloxone around, or how does that work?
Yes, so there are certain risk factors which predispose someone to potentially having an overdose. I mean, even if you're on a stable dose of an opioid, but it's a high dose. Let's say a different provider prescribes you something that might interact with that might increase that respiratory depression that we've talked about. You could be at risk. So there are numbers we kind of look at that would predispose someone to being more at risk. So it's important to have naloxone around for the higher dose. But a couple of other things I want to mention that also predispose someone is if they're taking a benzodiazepine-like medication. Those are typically sedative medications. If they have a history of a prior overdose, accidental or otherwise, if they have a history of a substance use disorder, if they've been treated for a substance use disorder for opioids, and they're at risk for potentially returning to a dose they were tolerant to before, it's really important to have naloxone available to them.
So is naloxone prescribed then? Always? That's how you get naloxone?
So that's a great question. So it used to be a prescription, and basically it used to be available only if your physician wrote a prescription for it. That's still a way you can get it. But in 2017, Montana passed legislation which allowed what we call a blanket prescription for naloxone to be available throughout the state of Montana. It's still a prescription product, but anyone that has a family member or a friend or someone that they're concerned they might be at risk, you can go to a participating pharmacy, a pharmacy who carries it, and get a prescription. It'll be in your name for naloxone. So that's awesome. It's really increasing the availability throughout the state and helping us combat this overdose epidemic that we've been faced with.
That's great. And so the big question is it saving lives? Do we know that naloxone is really reducing overdose deaths?
Yes, we do know that is happening, absolutely 100%. What we don't know is we don't really have any hard data yet on what those numbers look like, but there are lots of instances happening right now where it is in fact giving people that safety net that they are able to have another chance.
Okay, perfect. Thanks so much, Lisa, for
Absolutely.
all that information. We do need to take a break here quickly, but providing naloxone to patients who are prescribed opioids is just one way this drug is saving lives. We'll learn about another way right after this. Don't go away. We'll be back in 2 minutes. Stay with us. Welcome back to Healthy Living for Life. Joining us now is Detective Patrick McDuffie of the Lewis and Clark County Sheriff's Office. And thank you so much for being here, Detective.
Absolutely.
So can we start out by just asking, are all emergency or first responders now taking Narcan or naloxone with them when they're out on the streets?
I can't speak for every agency, but it's now available for every agency, for any first responder. It doesn't have to be a first responder. There's a training course that was coordinated through the state. And once you complete the training, agencies would send employees or associated personnel to the training and then to become trainers, and then they can bring that back to their agency and train the folks within their agency, and then they can administer Narcan. So the training I went to was in Missoula, and it was, there was school officials, there was a lot of different people from throughout the community involved with the training. So it's not just first responders, it's available for different people throughout the community.
Oh, okay. And so when did all of that start, where they started giving it out to people in the community?
In 2017, a bill was passed through legislation that allowed for Narcan or naloxone to be a lot more available. Before it was only available to at least advanced EMTs or paramedics on an ambulance crew. And then with the new legislation, it allowed for it to be available to a lot of different people throughout the community.
Okay. And you mentioned that you went and got training about it. What did that training entail, or what did you learn about?
The biggest thing that I got out of the training is there's no negative effects to administering Narcan. If there's any indication that someone may be in an overdose, to administer Narcan. If we have an elderly individual or somebody who may be at risk of a heart attack and there's no signs of of an opioid overdose, and we probably wouldn't administer it, but if there's any indication that there's a possibility of an overdose, it saves people's lives, and there's no negative effects to administering it. If someone's not in an overdose, there's no harm to that person.
Okay. And then you mentioned indications of an opioid overdose. What does that look like? How do you know when you arrive on a scene that someone could be overdosing on an opioid and need Narcan or naloxone?
There would be a lot of different indicators, one of speaking to witnesses, and then a second of just observing the scene and looking for any paraphernalia, any prescription bottles. And like I say, if we had somebody who wasn't elderly, or who may not have been a higher risk patient or person for a cardiac event, then we'd probably administer Narcan.
Okay. And then once you administer it, then what happens? What are the next steps?
Depending on the reaction of the patient, more than likely would be continuing CPR. If we find somebody who's in an overdose, we're probably, we're going to check their airway, breathing, and circulation. And if they're not breathing, they don't have a pulse, we're going to be doing CPR, and we're going to administer Narcan. And then if they don't respond immediately, we're going to continue CPR. If they do respond and become responsive, or at least get a pulse, then we'll put them into a recovery position and monitor the patient.
Okay. And so, being a detective with the sheriff's office, do you get a feel for, we've talked about that we're in an opioid epidemic. Do you agree with that? Do you get a feel for how serious people are using prescription opioids? What kind of problem is that really?
I think probably the biggest problem we have in our community, and I think it's become nationwide, is more of a heroin epidemic than prescription drugs. I think the industry has done a pretty good job of 10 years ago, we had a huge problem with prescription drugs being abused, but the industry is really taking a lot of steps to reduce the availability and the abuse of prescription drugs. And in that, now the users are going to heroin. And the prevalency of heroin in our community has absolutely exploded. For the last 5 years, I've been working on the Missouri River Drug Task Force as a narcotics detective. And 5 years ago, we per se didn't have any heroin in our community, and now it's as prevalent as methamphetamine or several other illegal drugs. It's everywhere, and it's being abused.
So you would agree that we're in an opioid crisis?
Yes, without a doubt.
Okay, and so with Montana and the other states that this show is broadcast to and that we share the show with, we're rural. Do you see a difference in people living in rural areas using opioid drugs versus maybe people living in more urban areas?
I think some of the more urban areas had it, especially to the west. It was there faster, it was there sooner than what we experienced. That we didn't have. Talking to other detectives in the Pacific Northwest, Washington, Oregon were having a huge issue with it before we were. Even Kalispell was seeing a lot more of it 5 years ago than what we were, but now it's everywhere. So it doesn't matter the size of the community. I do some work up in Lincoln, and we've had issues with it up in Lincoln. It's everywhere.
And you talked too that after it's administered, either you would continue doing CPR or the person is responsive. Do you think that one happens more than the other? Is naloxone saving lives? What's your experience from what you've seen? I was
on a call as a patrol deputy probably 8 years ago, and we responded to a non-responsive patient and started providing CPR to the patient. And once St. Pete's ambulance arrived, they administered naloxone. And I went up to the hospital a short time later, and the individual was alive. He was walking and talking, and didn't appear to have any effects from his overdose. And when we were initially on scene, nobody was telling us that he'd used any opioids, so we didn't know it was an overdose initially. So it, without a doubt, saved that guy's life. But I've had a lot of users telling me stories about where they've seen it administered by other users other heroin addicts, just because heroin's so dangerous, and then with fentanyl and fentanyl and all the synthetics that we're seeing out there, users are carrying Narcan, and it's saving their lives.
Okay.
Not even being administered by first responders, being administered by other addicts.
Okay, perfect. We're actually out of time, Detective, so thanks so much for your expertise and for being here this morning.
You're welcome.
We need to take another break, but coming up next, as we've learned, naloxone is saving lives and preventing opioid deaths, but it's only a temporary fix. There's more that must be done to help us out of this opioid crisis. We'll talk about that and more right after these messages. Stay tuned. Welcome back to Healthy Living for Life. More than 2.5 million Americans suffer from opioid use disorder, and opioid-related deaths have more than doubled in the last decade. We're joined now by Michael Solomon. Michael is a graduate from the Rocky Mountain Treatment Center in Great Falls and now works there to help others with their treatment. Thanks so much for being on again. And you were here last week, Michael.
Yes.
And we talked about your opioid addiction, and
Yes.
you were actually administered naloxone at one point. Can you tell us about that?
I was. A little over 10 years ago, I overdosed on fentanyl. And I was in my apartment, and I was blue, lifeless, fixated on my own vomit. My roommate had come home from work early, and she might have forgotten something at work, found me, called 911 immediately, and they administered Narcan, naloxone, and it saved my life. Unfortunately, I wasn't ready yet, and this disease is so powerful that when I got to the hospital that night, I went to get high again. It's unfortunate, but it saved me.
Well, and that's awesome, and
Yes.
we're glad you're here. And we've talked about naloxone being a temporary fix,
Yes.
and so you do have to go on and get treatment. We talked about your treatment a little bit last week, but can you tell us again, walk us through the process and how your treatment helped you?
Sure. Well, the first part of treatment is physical detox, getting the substance out of my body, out of the person's body, and then the next part is finding out how to deal with the underlying issues, learning how to, it's a feelings disease, it's learning how to be okay with yourself, be in group therapy, intense therapy. At Rocky Mountain Treatment Center we use equine therapy, which helps amazingly, and we learn communications and how to get vulnerable and raw and honest.
And then you got your treatment and then ended up going back to work at the center.
Yeah.
What was the timeline there, and why did you want to go back?
I came right back after about 5 months of being sober, and I was living in a sober living house, which helped me. So the reason I wanted to go back and work there is because I have a passion. Since I got sober, I have a passion for recovery. I found that my purpose and passion in life is to give back what others gave to me. When I was in treatment, the staff that helped me, I could tell they were on this journey too, and they were so passionate and about their journey that it helped me. It gave me hope, and so I just felt like I needed to, like it was my duty, and then I found quickly that it is my purpose. So.
And how long have you been at the center now?
I've worked there for about a year now.
Okay,
Yeah.
And do you see a lot of people coming through with opioid use disorder?
Absolutely, and it's getting younger and younger, where people are starting out with pills, but quickly, thank goodness, because our providers are prescribing less and less as far as the guidelines, but quickly turning to heroin and fentanyl to get that same opiate high. And that's where it becomes dangerous. IV use, mixing it with methamphetamines. So it's on the rise, and it's a crisis.
Are there specific therapies or techniques that is used at the center? They're used at the center specifically for opioid use disorder.
What we found is all addiction is rooted in the same thing. But as far as for opiates, Vivitrol, non-narcotic medications that block the receptors, which helps with cravings and then reduces any kind of high someone would get if they do relapse. Naltrexone, Vivitrol, that helps. Certain non-narcotic medications helps with the cravings, but then you have to get raw and honest and get into the program, get into the groups, get into the therapies, just like any other addiction.
How does treatment incorporate a circle of friends and family? Can you talk about that support group and how that's important?
Sure, and that's something I do at Rocky Mountain Treatment Center. I'm the alumni coordinator, and so staying connected with healthy people in recovery, getting in the middle of the herd, so to speak, and surrounding yourself by positive people in your life, friends, family, support groups, 12-step meetings, really helps. You know what I mean? It helps you, because it's a disease of isolation. That's where addiction thrives, is when you're isolated. When you stay connected and you have that support, it just makes the journey that much better. You know what I mean? And that much more fulfilling. It's very important.
And then the flip side of that coin is those friends or maybe even family members that are negative and not helpful. Can you speak to that a little bit?
Absolutely. Going back, we always say in the program, you got to change everything. You know what I mean? And that includes negative friends, negative places, negative triggers and influences, and that could include some family. If you are serious about changing everything in your life, a lot of people, and it helped me, from inpatient go to sober living. Maybe even in a different community than their own, to just establish a life of recovery and structure that had no reflection of their old life that they're used to. And so that support of healthy friends and really just getting away and blocking, even on social media, just blocking all those negative influences just makes the success rate that much better for you.
Okay, so we're almost out of time, but final thoughts. Somebody watching at home who might be using opioids or another drug, what's your advice there, Michael?
There's always hope. I always thought, am I too far gone? How can I live without this drug? How can I live without this? There is a solution. You can become happier than you've ever been on the drug, and there is hope. There is a way. Reach out. It is possible. Make that call.
Perfect. Thank you so much for being here. That's our show. I want to again thank Lisa Sather and Detective McDuffie for being here as well. And thank you so much for watching. We hope you'll come back again next week and see us again. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.